Hi and welcome back to the channel. Today coming at you is a very cold Dr. Ashley Hilton. It's absolutely freezing in London. It's currently snowing outside, so I'm triple layered at the moment. What we're doing today is bringing you yet another installment of the short interview series that I'm doing, where we take the 13 modules from my online interview course and give you the bare essentials that you need to do to go away and revise and make sure you know to succeed at your medicine interview. As always, you can see the full series in this playlist here. If you have any questions, as always, comment. If you're enjoying it, like, and if you want more of these videos, subscribe here and turn on notifications, and I'll let you know every time I bring out a video just like this. So today's module is going to be looking at empathy and how it combines with communication skills. Now, there are a few of these modules which kind of have a similar structure to them, and they're all the ones that relate to communication skills. So for example, your teaching, breaking bad news, and of course, stations in the MMI where you're being asked to demonstrate empathy. And that's because communication skills are such an important part of being a doctor, and medical schools today focus heavily on communication skills to make sure that yours are up to scratch from day one when you start as a doctor. And of course, you don't need me to explain exactly why empathy is a massively important skill for a doctor to possess. But just to define it, empathy is the ability to relate to other people's feelings. And it's really important that you know the difference between empathy and sympathy when you come to interview. So similarly to the other communication skills stations and modules that I have, this one in the full course revolves around a scenario where somebody is asked to exhibit empathy. But as I say, because this is a bare bones lesson, we'll skip that part and you can check that out by clicking the link below. But otherwise, we're just going to rattle through all the essentials that you need to know so that you can perform well when you have your interview. So in panel interviews, they may ask you questions around empathy, why it's important, what exactly it is, and have a discussion based upon it. But mainly when you're asked to exhibit empathy, it's going to be in a station in an MMI interview. So what skills are they wanting to see? Well, of course, the first one is communication skills. They want to see that you can connect with someone enough to build a rapport, that they are comfortable to share what it is they're concerned about or the fear that they're having. Then the second one, of course, is empathy. How do you react to the tricky situation that they throw at you by revealing something that's truly troubling to them? Because in these types of scenarios, it will usually be that they are scared of a procedure or that something is not quite right and they're not very comfortable, and they want you to go and speak to them to understand the reason. And usually the reason revealed is something quite serious or quite deep that they probably need some help with. The other skills they want to see are your ability to deal with an upset or angry patient, and we discussed this in one of the other modules. And then the final thing is knowing your limits and being able to seek support appropriately when it's the right time. So you may have noticed that there is a pattern to the station strategy for all of these MMI stations that involve communication. And usually I will teach you a 4-step approach to each, and this one is absolutely no different. So the first one is always the start. So that includes your introduction and then how you present what's about to happen with the scenario. So usually you will have been asked to come and speak to somebody about a difficult situation. So it'll go something along the lines of, "Hi, my name's so-and-so, and Dr. Smith has asked me to come and talk to you about your fears regarding ... Now, you've heard me repeat this advice in pretty much every module, but that minute of reading before the MMI station where you familiarize yourself with the context of the scenario is absolutely key, because that's going to help form your introduction and how you present the information or what you're proposing to do for the rest of the station. Stage 2 is then exploring the problem. 3 is picking up on any concerns, and 4 is agreeing upon an action plan together. Now, I'm going to take all of these stages and go through them in depth. Now, the start, just like in the other modules, is how you enter the situation, if you're there in person, how you walk, the eye contact that you make, your opening few lines, and how you introduce yourself to the patient. Although this scenario may be a potentially sad one, I don't want you to go in looking too gloomy. At the same time, don't be overly upbeat. Just get the tone just right for the scenario that's presented to you. But essentially, you want to look professional and neutral. Remember to always face the patient, and you make good eye contact online by staying directly down the barrel of the lens. And a good little trick in person is to scan the room for any props that are going to give you clues as to what might come up in the scenario. So in other modules, we've talked about introduction, but here I want to give you 3 steps to make sure that you deliver a really solid introduction that's going to set the tone for the rest of the station. And your introduction basically needs 3 things. 1, your name and position. 2, the reason that you've come to speak to them. And 3, get their permission to do so. So in this hypothetical scenario, this would be something along the lines of, "Hi, my name's Ashley Hilton. I'm a work experience student currently on placement here. Dr. Smith has asked that I come and speak to you regarding your appointment. Would that be okay with you? So then once we've done that, we proceed immediately to explore the situation and find out exactly what the problem is with the patient. Some general things that we want to do are form a good rapport with the patient, allow the patient space to talk, and finally make sure you don't pressure them into giving you an answer that they're not yet ready to do. So there are 3 things that you can do to instantly build rapport with a patient, and we have those in depth on the online course, so you can access that by clicking the link below. One of the best ways to build rapport is the good use of open and closed questions. Now, I'll briefly go on to explain a bit about each of those and when they are useful and appropriate. So open questions are broad. They usually invite an opinion or a point of view, and they're questions that usually start with why, how, or what. So for example, if it's an empathy scenario where you're trying to get the problem out of the patient, something like, what seems to be the matter, or what's bothering you? Even things like, how are you feeling? Closed questions usually prompt very specific answers. They're usually yes, no, or very short answers. They're either factual or confirmatory, which means they typically begin with do, have, or will. And these type of questions don't typically spark a conversation. So it will be something like, do you live at this address? Have you got 3 brothers? And conversation usually ends with a yes or no answer. So when you're in these scenarios, you have to build rapport quickly with the patient, and there are a few ways that you can do that. Now, that usually starts with a really good introduction. People underestimate how important a very tight and succinct introduction is. It creates a good first impression, it sets the tone, and it usually makes the rest of the station go quite smoothly for you. It's important to have relaxed yet professional body language, ask open questions, engage in active listening, show that you can relate to their problem, or if it's a really unfathomable problem, explain that you can't relate. So say, I can't imagine what that must feel like for you. And make sure you take your time, don't pressure them, and be receptive to what they're saying. So throughout the station, there will be clues that they have a concern. Sometimes they won't come out until you actually probe a little bit deeper, and that's them testing you to see if you can pick up on some of the concerns that they have. When you find a concern, you need to ask yourself one question, and that is this something that I'm equipped to deal with myself, or should I enlist the help of a senior? So be on the lookout for cries for help, and make sure if you see one that you dig a little bit deeper. That might be if they repeat the same thing a couple of times, that's provoking you to go and ask them more about it. Make sure if they say something that you match your verbal and non-verbal response to the level of the severity of the situation that they've just unveiled to you. Make sure again that you allow the patient space to tell you what's going on. It's important that you withhold judgment, and just to repeat again, some small statements of support are really helpful and score highly. So things like, I can't imagine how that must feel for you. So you may well be presented with a situation that you yourself are not equipped to deal with. And in that case, it's time that you escalate. So if you identify anything, it's important that you escalate it appropriately. This is something that we know very well in the NHS, referred to as safety netting. And the question that you need to ask yourself is, who do I need to involve to resolve the situation? By doing this, you will demonstrate that you're aware of your limitations, you're mature, you show that you can work within your limits, and ultimately that will mean that you are a safe doctor in the future. So once we've got through all of these stages, it's now time for us to close the scenario. And this is where we agree the next steps with the patient. So this will usually be one of 3 things. Either you are going to go with or help the patient speak to or go to a certain place that they can get help to resolve the situation that's arisen. They might ask you to speak to somebody else yourself. Or finally, you might point them in the direction so they can go and take care of it themselves. So when you create your action plan, you need to bear in mind the following things. Firstly, it needs to be a plan that you both agree on. It must be realistic. It needs to be appropriate. All the while, you need to make sure that you maintain the patient's confidentiality. You need to ensure that it's a plan that you're both happy with. You need to make sure that all the while you respect the patient's boundaries. So let's summarize the 4-step strategy that we're going to use when we tackle these empathy and communication stations at our medicine interviews. The first is a solid introduction, and that's going to serve to build rapport. Then we start with some open questions to explore the issues. The third stage is that we then ask narrow questions if we pick up on any concerns and deal with them as they arise. Of course, this is where we demonstrate the most of our empathy by relating to the patient's feelings or problems that they're having. And finally, number 4 is that we create an action plan that both parties are happy with. So let's finally wrap up with some tips to help you score well. The first is it's important to start with a really strong introduction to build rapport. Make sure you use open questions. Remember that you can show empathy verbally as well as non-verbally. Look out for any clues. verbal or otherwise, that are going to show you that you need to dig deeper in a certain area, and then finally show that you know you should always work within your limits. So that brings us to the end of this module on empathy and communication. As always, you can check out the full playlist by checking here, and then if you want to get some more videos from me, just subscribe and turn on notifications. If you want to check out all 13 modules, you can do so by clicking in the link in the comments and accessing that course, where we have 15 hours of online videos teaching you how to do amazingly and perform really well in your medical school interview, whether it be MMI or panel interviews. And on that note, I will thank you very much for joining in once again, and have just the most fabulous day.